Hi, my name is Jennifer Slough, and I'm one of the instructors with the Physical Therapist Assistant program here at San Juan College. And today I want to talk to you about physical therapy in general, being a PTA versus a PT, and other great information. All right, so what is physical therapy? Physical therapy is a treatment provided by a licensed physical therapist, or PT, or a licensed physical therapist assistant, a PTA, and we treat all kinds of things. Movement and physical function or dysfunction is where our wheelhouse is. We manage pain, we manage chronic conditions, or if they're fresh out of surgery, we help get them back on their feet. So specifically, a physical therapist is a licensed doctor, okay? When you go through PT school, you actually come out with a doctorate of physical therapy. So what does that mean? They can actually diagnose and treat. So if you think about when you go to your own doctor and you've got a stuffy nose and you don't feel good, they are diagnosing, is it flu? Is it a cold? Is it COVID? PTs do the same thing, but they're looking at body function. So if you have a messed up shoulder, they're gonna assess it, see what's actually going on with it. If you've had a previous stroke, what are the dysfunctions that are happening in your body because of that stroke? They're looking at those things, diagnosing it, and setting what we call as a plan of care. The Physical Therapist Assistant, which is our program, is a license-based program, meaning once you get done with it, you will take a licensure exam that's good on all the states. But we actually take that plan of care and start treating a patient. So whatever they come up with, they give kind of a brief overview of what's going on. We take all that information and turn it into treatments over multiple weeks to help patients. We can obtain data information to help the PT, and in conjunction with the PT. We are not physical therapy aides or technicians, which you may have heard of. Oftentimes these are current students in PTA and PT programs, or people that just help keep the clinic clean. They help do laundry, things like that, but they're not actually treating patients. So more than 21 million US adults have a disability. We see many more than that who just have an injury. So in a nutshell, the PTs diagnose and evaluate, and we implement the actual plan. So 7 things you didn't know about physical therapy. Everyone gets us confused with these things over here. We are not personal trainers. Here's the difference. If you want to look like The Rock, you go see a personal trainer. If you get injured trying to look like The Rock, you come see us, okay? Massage therapists. Although we do some massage therapy, ours is geared toward a very specific part of the body, and we're trying to get rid of inflammation or trying to get a joint to move better, whereas a massage therapist is really trying to get you to relax. It's a full body massage, 2 very different things. We are not athletic trainers, but you can get dual certified as either a PT or a PTA and an athletic trainer. So if you watch sports on TV, and if you're watching football, America's pastime, and that athlete gets injured, the athletic trainer runs onto the field. They're the first to assess what's going on and decide what needs to be done, okay? So as a PT and a PTA, again, you can get dual certified and be that person, but oftentimes they're the first on the scene and we're working in the back to help them get over what happened on the field. We're not chiropractors, but this is another area where there are many clinics that have PT and chiropractic services together. So a chiropractor is more about looking at spinal conditions and fixing things from the spine. So if you've ever been to a chiropractor, you may have had to get in a weird position and they popped and snapped and cracked your back. We can do some of those manipulations, but it's very different. So whereas they're trying to adjust the spine, we would then take that patient and then help the musculature around the spine to help hold that adjustment in place. So again, multiple places that have both, but 2 very separate things. What we are is movement and body mechanic experts. If something isn't moving correctly on the body, we can fix it. We're licensed clinical specialists. We are evidence-based practitioners, and in this program, you're trained to treat all populations. So one of my personal favorite things about physical therapy is that we treat across the lifespan. So all the way from birth to the end stages of life. Me personally, I've treated from 5 years old up to, I had one patient that was 101. and wanted to continue gardening, it was fantastic. But, and everything in between. So there's really so many options that we'll talk about in just a second on places you can go with this field. PTs and PTAs work throughout the healthcare system. So you may know outpatient clinics and that they work with sports and fitness facilities. What you may not know is a lot of them work in hospitals and acute care settings. So this could be after an injury, a car accident, stroke, anything like that. Lots of PTs and PTAs work within that hospital, and they're the first to treat right after the injury occurs. They can be in nursing homes and assisted living facilities. Home health is where you go into the patient's home. What's nice about home health is you can tend to set your schedule a little bit more, and there's a lot of freedom with home health. Schools, we do have PTs and PTAs that go into the school setting. So that child might be under something we call an IEP, and that is where they have something going on with their body, so they may get pulled out of class or they may be in a specialized class, and the PTs and PTAs are working with them before sending them back. Military, public health, all kinds of fun things. Okay.
Should I?
Nope, keep going. Although I don't know what we're gonna do.
You might have to step and hit it.
Are you kidding me?
You might have to.
Christina, I was on a roll.
Just go and hit the slide and come back.
Okay. Oh, that's gonna be annoying. Okay. PTs and PTAs treat multiple body systems, okay? So most people know we do musculoskeletal and nervous system. I've mentioned stroke, but also if you have a traumatic brain injury or if you have an injury to your spinal cord and can't use your legs anymore, then we would come in and teach those patients how to perform better with what they still have. But we also do cardiovascular and respiratory. So if you've ever had a family member that had a heart attack or some kind of major heart event, there's specialized physical therapy that helps get those patients back to where the heart is pumping better and recovering well. Same with COPD for physical therapy. We can work with those patients and get them to optimal levels within their current function. A lot of people don't know we actually treat wound care. There's a whole section of physical therapy dedicated to wound care. Skin burns, injuries from diabetes, things like that, we can treat it. A new area of physical therapy is reproductive and women's health specifically, but traditionally, women have kind of been ignored once baby comes out. Now we're finding out that if they get into physical therapy, their quality of life improves dramatically in a much shorter time span than without physical therapy. And birth is trauma, we can help the body recover faster. Urinary incontinence kind of goes in with that. Any kind of autoimmune things, digestive problems, sky's the limit. This is gonna be awesome. Okay, so we've kind of talked about these already, but PTA proficiencies, these are all the things you can specialize in. So acute care in that hospital setting, again, cardiovascular pulmonary, geriatrics, working with the elderly population. We often hear students say they want to work in sports medicine until they start working with the elderly population and figure out how fun they actually are. Orthopedics, which is just musculoskeletal, the kiddos with pediatrics, again, wound management, and even cancer patients. So there are two different physical therapy pathways, and we treat it as two different pathways. This is not really a stepping stone, so to speak. You really need to decide which way you want to go. So if your goal is to become a doctorate of physical therapy, this is what you're going to have to complete. You're going to have to get your high school degree and then a bachelor's degree, plus all the prerequisites that they require to get in that program. So you're looking at an average of 4 to 5 years to complete that. Then another 3 years as going through a DPT program, and then it's the licensure exam. For us, it's the high school diploma. We do have some prerequisites to get into our program. It's up to you on how fast you can complete them. You'll do a 2-year associate degree and then the licensure exam. Nice thing about it, you can be making a really good salary in a much shorter amount of time. Now there are a couple of PTA to PT bridge programs. They're highly selective, they're kind of hard to get into. This is not like nursing and nurse practitioner from a basic RN. This is, you need to choose which one you want to go through and avoid yourself a big headache. Okay. As a PT or PTA, you can obviously be a licensed practitioner. You can own your own clinic as a PTA. Travel PT is something that students are often interested in. So one of my good friends that I graduated with chose this option. She found a company, she set the states where she wanted to go. She went to the East Coast, she went to the West Coast, she went to Hawaii. Her dream job was to work with veterans at a veterans hospital. So she waited after she had completed her travel, waited till the right position opened up, got out of it, and absolutely loved it. That's a really neat option in our field. You can do what we do here, which is be a program director or an instructor, researcher, entrepreneur, all the fun things. Is this super weird? Okay. So why choose physical therapy? This is a wonderful, wonderful field. What's amazing about being a PTA is that you'll have a patient that comes in, and one's popping to mind right now. He had a massive car accident, broke many, many bones all over his body, came in a wheelchair, and by the time he was done with his physical therapy treatments over a couple months, he was able to walk out of our clinic and pick his grandkids up. That is an amazing thing to see in the medical field. We focus on getting them back to life, which is critical, and we help improve quality of life. I've taught patients how to get down on their knees to continue to garden. I have taught athletes how to protect their knees and get them strong enough to go back out and take more hits in football, all different things. And that is all in one day, because the clinic I worked in, I treated all ages and all kinds of different things in one singular day. Physical therapy is a growing healthcare profession. We're a top-ranked healthcare profession. People are always getting hurt. They're always getting injured. So median salary, and this is for the whole United States, 101 for a PT or 65 for a PTA. If you think about the differences in school, that is significant. In the state of New Mexico, with the various help that you can get for your education through college, you could come out making this kind of money without having spent much on your actual schooling. It's pretty amazing. We build relationships with our patients. And I'll tell you, as a current PTA, the difference in why I chose to become a PTA is because I didn't want to do evaluations all day. I wanted to build those relationships. I wanted to work with my patients, see them get better, and that was my focus every day. You get to see the direct impact of your work as they improve, as they get up and they walk, and their smiles from not having any more pain. It's absolutely rewarding. Okay, here we go. So we do change lives. This slide shows you some of our previous students. This is a kids camp that used to be held at San Juan College. The kids would come with various disabilities, and our students were in green, and they would work and be assigned to various kids and teach them all kinds of activities. You can see some archery here, which is neat. They were riding the tricycles, all kinds of things. Over here, this was a gentleman who had a spinal cord injury, and he was showing off his really cool truck that had all the bells and whistles so that he could continue to drive. And this is actually not a local clinic, but it's a previous student who was at a robotics clinic. Super fascinating thing. They actually had a gamer on staff that would design virtual reality games specific to patient needs. So cool, so advanced. What he's in is a gadget that basically teaches a patient how to walk again and simulates the movement of ambulation. Very interesting stuff. So be sure that you check out the information sheet that should be provided from your instructor. It's got a lot of great information on it. If you have further questions, reach out to the advising department or Sandra Sorrelhorst. She's the admin for our program, can answer a lot of questions. And there's a fun balance activity that should be happening after this presentation. Thank you.